Welcome back. I am Joseph Adumambu. This is Primetime News on UAV Television and Radio 101.7 FM. Let's take more stories. Deputy Chief Medical Officer of Public Health at the Ministry of Health, Dr. Ali Wuri, has said the alarming consumption of harmful narcotic drug, tobacco, poses significant burden on the health and economy as billions of leones is spent annually on addicts. Dr. Wuri raised these concerns while serving as the guest of honor at the commemoration of the World No Tobacco Day, organized by the Ministry of Health and World Health Organization. Our reporter, Mamunatu Suma, files in this report.
Tobacco is a leaf that is dried and processed into cigars, pipes, and now shishas. The leaf contains over 5,000 substances, and the most dangerous compound is nicotine. Experts say the narcotic drug leads to 56 different diseases, including cancer and reproductive health risk. A report from the WHO shows that more than 8 million people die from the consumption of tobacco, including an estimated 1.3 million non-smokers who are exposed to second-hand smoke. The World No Tobacco Day serves as a global reminder of the significant challenges in combating the intake of the destructive products. Dr. Ali Wuri, Deputy Chief Medical Officer of Public Health at the Ministry of Health, while delivering his keynote courtesies on the commemoration of the day, emphasizes on the alarming trend of the drug in Sierra Leone.
Tobacco use, especially among young people, often serves as a gateway to the use of other substances, such as caffeine, prescription drugs, and illegal drugs. As we all know, the use of these substances is increasing in Sierra Leone, and unfortunately, they are widely available and accessible. Targeting young people through the development and introduction of flavored tobacco products, glamorous advertising of new products such as electronic cigarettes, or normally known as e-cigarettes, heated tobacco products, and the aggressive use of social media influencers to create lifelong customers regardless of the cost to public health.
The roots of World No Tobacco Day go back to 1987, when the World Health Assembly passed a resolution calling for a global day to draw attention to the tobacco epidemic, and Sierra Leone is among the countries that have ratified the international law on tobacco. Dr. William Miner brings out the statistics globally with regards to the consumption of tobacco.
Tobacco industry interference. And this theme is aimed at mobilizing international efforts to shield young people from the harmful tobacco and nicotine products and the deceptive strategies often used by the tobacco industry to market these products. Globally, more than 37 million young people aged between 13 and 15 years are using tobacco. Out of those 7 million are in the African region. So amongst those are boys and girls in Sierra Leone who are using tobacco products. It is estimated that 1.3 million people die from secondhand smoke. So when somebody smokes next to you, you are more affected than the person who is smoking. So even if your uncle or your dad has smoked for 20 years, and they are smoking next to your mom, next to your brother, and next to you, they are also killing you. Because your mom, your brother, your sister is going to die of those diseases that were put here, even though they have never put a cigarette in the mouth. So you must tell them, smoke away. If you have to continue smoking, do it away from us, or even better, stop smoking for them to live a long life.
The Tobacco and Nicotine Act of 2022 was passed into law in 2023 to control and regulate the production and manufacturing of the substance. Speaking on the Framework Convention on Tobacco Control, Quality Control Officer at WHO points out the propositions in the framework.
The reason for the act, as you can see, is to protect public health of residents of Sierra Leone, protect the rights of the non-users of tobacco and nicotine products to a clean and healthy environment. And one of the things you have to realize, even when we talk about the Sustainable Development Goals, 3 says about promoting healthier lives, isn't it? For all, at all ages, meaning even children have the right to be protected for a better living. Yeah? And the last one there was to ensure that services are available for rehabilitation or for those who want to quit. Because
even though strides have been made by the government in minimizing the consumption of the drug, as seen in the formation of laws and policies, it is equally important to implement concrete actions such as the elimination of planting and production of tobacco in the country. Memuna Tusuma.